So my name's Stella. I'm a finance photographer and a mental health advocate. It's not a secret that I've had a very long battle with self-harm, and my arms tell that story, but most of the time I let the scars speak for me and I don't really say anything about it.
We don't treat the early stages, come back if it gets worse. And that was really heartbreaking for me because I was like, well, what about prevention? What about helping people to save their lives? Because I'm not going to make it if this ends up getting much worse.
Things can change, that things can get better, that this isn't who they are, this is how they cope.
You know, I was pissed off because I went to this treatment, I did all this work, and why do I feel even worse? And I found the help that I was seeking. It just wasn't getting to it. It wasn't getting to the bottom of it. It wasn't making anything better.
Are we doing a great job? No. Could we do a better job? Yes. Are we doing a reasonable job? Probably. Certainly better than we were 10 or 20 years ago. I have to say that for sure. That gives me hope. Have we got a long way to go? Absolutely, we got a long way to go.
It has many different names: self-injury, self-harm, self-abuse. Many people associate it with cutting, but really it includes any other kinds of destructive behavior people inflict upon themselves. In Canada, roughly 14 to 24% of teens have said they have self-harmed at least once in their lives. The numbers are similar for college students, but drop to about 4% in adults. When things like eating disorders, which are sometimes considered self-harm, are factored in, those numbers go way up. Stella Ducklow has been silently cutting for years, but now, for the first time, she's decided to tell her story.
I think it affects a lot of our youth, and it's not being talked about. And when it's not talked about, it ends up coming out in these really negative ways, like, you know, the Cut for Justin Bieber campaign on Twitter. Like, that's a result of us not speaking about this problem and not addressing it.
Well, internet trolls have launched this new campaign on Twitter. It's apparently to stop Justin Bieber's alleged weed habit. It's called Operation Cut for Bieber. It's so disturbing here. It's urging his fans to cut themselves in solidarity. Its motto, you stop drugs or you stop using drugs, we'll stop cutting.
And so, you know, even though it was a joke, even though it was nasty, even though it was like, you know, clearly even making fun of people who did that, people who self-injured still engaged in it because there's nothing else to engage in. The internet has become the expert. And that's really bad because anybody can write anything on the internet.
Laura Burke has struggled with schizophrenia. When she was young, she started hallucinating and experiencing other symptoms of psychosis. At her lowest point, she contemplated suicide.
I thought, well, I really can't do this anymore. I thought everything I read about psychosis and schizophrenia online was that it disintegrated into ultimate disability, and, you know, I'd be in the Bridgewater mental health unit where my parents would visit me every 2 weeks for the rest of my life, and I didn't really want that. So, and that was, of course, a mistaken view, but I didn't know that at the time. So I thought, okay, I'm going to have to see if I'm brave enough to take my own life, so I'm going to practice. So that's when I started to cut myself to practice. I am kind of the exception in that way. I think most people do it as a way to relieve stress or pain or suffering, or as a way to cope in different ways.
What I've felt and what I've heard described the most is either people hurting themselves because all their feelings are just far too intense and painful, and, you know, they want to feel the pain physically instead of psychically, and it relieves that. And the other description I've heard is people not really feeling anything at all and being like, you know, am I still alive? Can I still feel something?
Growing up, Garrett Linz loved playing sports and always did well in school. She even graduated magna cum laude from university, something she's very proud of. But she's been self-harming for as long as she can remember.
Pulling my hair out, punching myself, whacking, banging my head off stuff, and a lot of scratching.
In high school, her self-harm expressed itself in a new way, this time as anorexia and bulimia.
I'd hate it, I detest it myself, and I was just trying to get rid of everything on the outside to help what was going on the inside, and I was just, honestly, I was wasting away, and I was starving all the time. I grew that hair that you grow when you starve yourself. I was lost, I was losing hair. My nails were in bad shape, like everything was in bad shape. I was dying, really.
Did you care?
No. I didn't care at all.
Jackie Kinley is the director of the Mental Health Day Treatment Program at the QE2 and is internationally recognized for her work treating people with personality disorders. She has seen many patients that have dealt with self-harm.
It's a double-edged sword because on the one hand, it's punitive. It's a way of, there's often a component of kind of self-loathing or, and it's usually done in isolation, right? So, and then on the other side, there's a release. There's a sense of control that comes with it.
By controlling your intake of food, you could control how you looked, so then you could control how you felt. So if you look better, well, I'm gonna feel better. But the more you control your intake of food, your exercise, your calories, it actually did the opposite and you really spun out of control more. You were losing control by doing that to yourself. And the disease was gaining control.
Stan Kutcher is an internationally renowned expert in adolescent mental health and leading researcher. He is currently the Sun Life Financial Chair in Adolescent Mental Health.
People who have self-harmed and if they have scars to show that can often be treated with pariah-like status. They're judged, but instead of being understood.
Yeah, I was afraid of people's reactions. I thought that, I would be isolated and judged, and I expected when I started wearing short sleeves and stuff, or just not covering them all the time, that people would ask me questions. Like, I prepared myself for it and I prepared answers, and people don't say anything. They tend to either sort of stare at you and then kind of dismiss you and just be like, I didn't see that. Or they will sort of like stare at you. But very few people have ever asked me anything about it.
I have patients that cut in the same way that I have patients who drink or gamble or, do any of these, on the surface, irrational things.
Yeah, it's like any addiction. It gets harder and harder to stop, and you have to keep doing it more and more to, like, in my case, like, relieve the anxiety I was feeling. Like the release of dopamine where you're sort of like, and you can kind of let go of things again, and then you'll keep seeking that and seeking it and seeking it and seeking it. And that's where the problem is. In like the case of, an alcoholic, they would have to drink more to get drunk. It was like I almost had to cut more to sort of get like normal.
These are complex problems and they require a certain level of training and a certain level of insight and understanding. The medical system focuses so much on the symptoms and on the surface, looking at the behaviors, looking at the symptoms, and really doesn't try to understand the person underneath those symptoms.
I'd hurt myself pretty badly, and I was about 19. I guess I remember coming in one time and it was like very clearly not in a good situation, probably shouldn't have been sent home, was, like literally covered in blood. Literally, like I walked out of a horror movie. It was, it slipped. It wasn't supposed to happen and it did. I ended up there and I said, don't call psych. Like, I don't want to see psych. And they said, okay. And they got a medical student to sew me up, and he was very nervous because he didn't know what to do or what to say to me. Basically, just on the way out, he just patted me on the back and said, don't cut yourself anymore. And I got like 22 stitches, and they didn't call one person, or not one person said, "Are you okay?"
I mean, I had a nurse say to my mother that, because I have these self-harming behaviors and because there's some perceptual disturbances, that must mean that I'm borderline, which means that I'm manipulative and not to listen to anything I have to say for the rest of my, mental health journey. And of course, these things are not synonymous, but, being manipulative, being borderline, I didn't turn out to be either.
Every person that self-injures ends up being diagnosed with borderline. The problem with borderline personality disorder is people think that you are extremely manipulative, that you're attention seeking, that you don't know the difference between negative and positive attention. They might not have any of those traits beyond self-injury, but that's the only mental illness that really has self-injury actually listed in the diagnosis. And so it's massively overdiagnosed, and once people get that label, it's really hard for them to get help because no one wants to help them because it's considered almost untreatable. And that isolates those people, and that makes them feel shitty about themselves, and then they self-injure, and it's just a horrible cycle. We're creating more barriers for people in the medical system than we are helping them by throwing these diagnoses around.
Diagnoses are overused. Diagnoses help to, I think, give the provider a sense of knowing. Okay, I know and I understand. And the danger is they feel like they've kind of encapsulated the person.
Calling it a brain disease is not helpful. Calling it something that is so different than what other people experience and instead of on a continuum is not actually really helpful. We need people to be able to empathize on a really deep level, and I know they're working at 100 miles an hour in there in the ER and everywhere, so it's hard, but it's really necessary if we want people to actually get better.
The emergency room personnel are very often looking for the highest acuity because that's what they have to deal with first. A superficial self-harm would not be identified as high acuity. And so that because the system is like it is, the people get triaged to very low acuity. And then wait. The other aspect of that is the stigma and the lack of understanding. And we know very well that for people with a mental health problem or a mental disorder, when they access emergency room services, that stigma really gets in the way of getting the type of care. And the third thing is, in fairness to the incredibly hardworking and wonderful people that are in Emerge, they don't have the services there. They don't have the resources to actually deal appropriately with that part of the population.
Many people I talked to said there is a lack of understanding and a fear surrounding self-harm that ultimately leads to silence.
There seems to be this idea that if we talk about self-harm, or if we admit to self-harm, or that it will lead to other youth doing it, and it will spread like the flu.
Self-harm can at times be associated with a contagion phenomenon, just as suicide is sometimes associated with a contagion phenomenon, just as stomach aches are associated with a contagion phenomenon, just like, oh my gosh, I smell this terrible thing and I'm going to get sick from it, it can be associated with a contagion phenomenon. So all these different kinds of behaviors, there are contagion components to many of them, and the self-harm is no exception.
It's not about whether or not you talk about it. It's how and why you talk about it. So I absolutely talk to people about self-harm. How you talk to them, you want to talk to people in a way that's not shaming, right? That is destigmatizing, that is understanding, and why you talk about it is to help them.
When I work with youth in hospital, I'd say like more than 50% of them are self-harming, and yet we have no specific program to treat self-harm. We don't have any kind of rehab or specialist or department or national charity to deal with this, and I think that's really sad.
It's an area that makes people feel very uncomfortable. And when people tend to feel very uncomfortable at something, often there are two easy routes that they can take to deal with that uncomfort. They can avoid it altogether or go not to talk about it. Or they can do something that shuts off the conversation, just like you said earlier, well, it's just for getting attention. End of conversation, let's go on and do something else.
If we want to address youth suicide, we should be addressing self-harm, because that's a humongous red flag. That's when they're still trying to find a way to make it work. People read into it wrong, and those people aren't getting the proper help.
As soon as you get into a healthcare system route, you're in trouble, because it's usually young people that are accessing that, and it's usually young people accessing that through the mental health care system, which is woefully underfunded and woefully unavailable to young people.
Nobody knew in high school or my first year of university. I didn't really hit my bottom until like second year, where it started to become clear that I was out of control and my life just crumbled really quick.
Self-harm is complicated, and so is helping people who do it. But people close to the issue say it's clear more services and help are needed.
Because self-harm can be part of a multitude of different underlying factors, the treatments have to be very uniquely personalized. And not all treatments have the same impact. Even if they are uniquely personalized, sometimes treatment fails some people.
Patients should be able to come into the system and be able to step into a service that matches what it is they need, and a clinician that understands what their difficulty is, and then once they finish that piece of work, then move themselves out of the system. Unfortunately, patients come into the system and they never get out. Or if they weren't crazy when they got into the system, they'll be crazy when they get out of it, because the way that the system is structured is so fossilized and so rigid now that it's crazy making.
You know, I have a list and I made sort of like levels. It's like, you know, if you're this upset, you know, try doing like these list of activities, like, you know, try going for a walk or listening to music or reading this book that's calming or doing yoga. And then if it's like, you know, if you're like more upset, here's a list of people you can call, you know, and if you're more upset, here's a list of people that you can call and who will come over. And having a safety plan is a really good thing, because when you're actually in a crisis and you totally forget what you're supposed to do. So that's why there's the plan. Like, you know, you have a first aid kit, like you have a psych emergency kit.
The number one issue that we have to change here is enhancing access to effective mental health care and primary care.
I became involved in 12-step programs, and that really helped, going to groups that way. That taught me how to live. I wish I had found that years ago, because that's what taught me how to live.
If you or I were thinking carefully about how we're going to set up a system that will actually identify and help young people or anybody who has a mental health problem or mental disorder, we would front-end load that system so that we would make sure that at the biggest time of onset of these disorders, which is 10 to 15 years following puberty, that the system would be structured in such a way as to receive, support, understand, and treat. It's not set up like that.
The biggest step is to get rid of stigma, is to realize that we are all interdependent, that everything that we do affects everyone around us, that people who are in the ER who are really vulnerable are affected by the way we treat them.
The stigma behind mental illness in general has a lot to do with self-harm, at least in my world, because, you know, being isolated like that and being judged like that and being put on trial in the media every time there's a shooting, it doesn't breed good feelings towards yourself, you know?
My struggle and the struggles of hundreds of other people have been kept silent by stigma and societal shaming. Maybe if I had known that cutting would end up limiting my career option, devastating my family, taking over my identity, forever altering my appearance, and generally throwing into question my credibility as a human being, maybe I wouldn't have made that first red line. Maybe I wouldn't be the cautionary tale that stands in front of you right now. This has to change, and we are better than this. So if you know someone who's affected by self-injury, please talk about it, because the silence is not working. Thank you.